Okay, good afternoon, everyone. I'm Sara Pantuliano, I'm Managing Director here at ODI, and I'm really delighted to welcome you all, both in the room and online, to this afternoon's discussion. Next week is Refugee Week, and we felt, on the eve of Refugee Week, we really ought to reflect a bit more on how we collectively do or do not support refugees' own aspirations. Very often we tend to look at refugees as, passive recipients of aid without recognizing the entrepreneurship, the activities, the work that each of them does, to really pursue their own aspirations and objectives. So we've recently, I think it was 3-4 weeks ago, hosted a debate on employment, jobs for refugees. And we wanted to carry on that conversation here to the eye, particularly because a number of my colleagues have been doing research on how refugees really do pursue their own objectives and aspirations using their own resources, assets, networks. And we wanted to have the opportunity to reflect on the findings of this research. This is research that Veronique, who is here on the panel today, has carried out with other colleagues in the Central African Republic and Cameroon, in Malaysia with the refugees from Myanmar, and in Jordan, Turkey, and Lebanon with refugees from Syria. So we'll reflect on that. But together with Veronique on this panel, I've got some fantastic colleagues to help us think through, these issues. I'll introduce them in a second, but before that, I wanted to also welcome our online audience, which is very numerous today. You will have an opportunity to interact with us. You can put your questions and your comments through the chat. I'll take them once we've had the first conversation on the panel in the Q&A. But for those who are in the room, please put your phones on silent. You're very welcome to tweet. In fact, we encourage you to tweet. The hashtag is Refugee Lives. But please, make sure that your phone doesn't interrupt the conversation. Let me come to the panel. So I did mention Veronique. Veronique Veronique Barbelet is a research fellow in the Humanitarian Policy Group here at ODI. She has a background as a political scientist, and she's been doing a lot of research on displacement issues as well as on a number of other issues related to conflict and security, protection, livelihoods, and gender-based violence. She led the work in the Central African Republic, and she's done research in other contexts in West Africa, Central Africa, and Sudan and South Sudan. Over the pond from New York, we have Lorna Solis, who could not be with us in London, but I'm delighted that she can join us via video link. Lorna is the founder and the CEO of Blue Rose Compass, which is a really interesting non-profit organization. Lorna will tell us more about what she does, but her work is very much focused through Blue Rose Compass on helping young refugees develop, their talents, pursue educational opportunities, find a way to study, beyond the areas in which they are displaced. Lorna is also the founder of Link, which is a corporation that empowers, young refugees to find employment so that they can release their host communities. But she actually has a background as an institutional investor. You wouldn't know that, but she's got a business background, worked in Wall Street, and then decided to put her talents to better use and to support refugees. She is a member of the Council on Foreign Relations, a young global leader for the World Economic Forum, and a fellow member of the Global Future Council on the Future of the Humanitarian System. To my right, I'm really delighted to welcome Ziad Ayoubi, who is the head of the livelihoods unit at UNHCR. Ziad has been working on local economic development for almost 20 years, but at UNHCR has really been, trying to manage economic programs targeting refugees and leading, the whole global reform of livelihoods programming for UNHCR. He's overseeing the rollout of the global strategy for livelihoods from 2014 to 2018. I'm sure we'll hear a lot more about it. And then last but not least, to my left, Tamam Maloudat, who is the Deputy Medical Director at Médecins Sans Frontières Switzerland. Pleasure to have you here, Tamam. Tamam is a Syrian medical doctor. He's a public health expert. He's a veteran of the humanitarian sector. He's worked in all sorts of different settings with the Red Cross, Red Crescent movement, Save the Children, and with MSF. And his expertise is on medical humanitarian ethics, conflict, humanitarian assistance, non-communicable diseases, and mental health in emergencies. You studied medicine at the University of Damascus, but then came to London to do his public health in developing countries countries degree at the London School of Hygiene and Tropical Medicine. So a great panel to discuss how we can better support refugees' aspirations, a lot of direct expertise from the ground. Let me start with Veronique. Vero, you've been spending the last couple of years really trying to understand better how to figure out what refugees do, when they're in a crisis, what kind of, avenues they pursue to really meet what are their own objectives. What are the key findings? What are the key things that really struck you in this research?
Thank you, Sarah. So first, I'd like to pay attention to this report that we just put on your chair. This is the executive summary of a forthcoming report that we're putting together at the moment. And this is bringing together all the research work that we've been doing over the last 2 years with Rohingya refugees in Malaysia, Central African refugees in Cameroon, and Syrian refugees in Turkey and Jordan. And so today I'd like to highlight some of those key findings with you. Of course, not all of them, but look out for the forthcoming report, which should be out in a few weeks' time. So when we started this research, we were really looking at we were thinking that one of the reasons why the lives and livelihoods of refugees was not better supported by aid agencies and their perspective integrating was from a lack of understanding of refugees' own agencies, so what refugees do themselves, how they, what kind of aspirations and objectives they have, and the obstacles that they are facing. And also we wanted to look at whether there was a lack of understanding and what refugees, how refugees relied on more ad hoc informal networks in their surroundings. So that's family, friends, and also individuals in the host community. Interestingly, what we found is that there's not so much a lack of understanding of what refugees do or a lack of understanding of these informal networks and where support lies for refugees in displacement, including the more informal ad hoc support. But really, there was a lack of integrating this knowledge and this understanding in what agencies were doing and the way they were intervening. So I'd like to point out to some of the issues that we found. First, we found that the perception of refugees and the perspective of refugees continues to be gathered, but in a very ad hoc manner, and often post-intervention and post-policy change by aid agencies. And what that means is a lot of interventions, therefore, assume rather than know what, or assume the impact of the interventions on the lives and livelihoods of refugees. One example that we came across was the work permit schemes in Turkey and Jordan, and that was quite interesting to look at how refugees were reacting to what was felt from the aid community as being a very significant positive step towards helping refugees and their livelihoods and fulfilling their aspirations. Interestingly, what we found is that refugees felt that this step, which was quite sudden, was actually bringing more uncertainty to their lives. And the fast policy change was increasing that feeling of uncertainty that many refugees face. It also increased the lack of trust in the national policy framework and the lack of trust that these policies were going to continue being positive for refugees themselves. Most refugees felt that these work permits were not applying to their own individual circumstances, either because the sectors that the work permits were applying to were close to, the work permit were applying to were not where refugees wanted to work or were already working, but also the data that refugee employers would actually agree to go and apply for work permits. And this example is very interesting for us because what it highlighted is that often in trying to support refugee lives and livelihoods, we forgot some of those more subtle psychological elements of what drives refugee choices and refugee strategies. And we found that things like uncertainty, feeling stuck, feeling in limbo were very critical aspects of the way that refugees were making decisions about their lives and their livelihoods in displacement. We also found that livelihoods continues to be very sidelined or an afterthought in responding to a movement of refugees. And that was quite interesting because talking to different humanitarians on the ground, there was a feeling that there was still this assumption that newly arrived refugees were necessarily vulnerable and that with time, refugees were becoming less vulnerable. And actually, when we talked to refugees, we felt that the story was quite different. It does not say that, especially in Cameroon, some of the Central Africans that arrived in Cameroon, the first few weeks or days were needing life-saving assistance. But many came with assets, financial assets, social capital, human capital, financial capital, and these assets were actually depleting over time. So when livelihood interventions were finally on the table for a lot of aid agencies, those refugees no longer had their own assets and had really struggled. And that does not mean that refugees cannot do it themselves and necessarily need support, but what we found is many refugees have these assets, and they are often faced with obstacles that require external interventions. But they still have their own agencies and they still do a lot. And finally, one of the things that continues to be challenging in better supporting refugee lives and livelihoods and understanding their aspirations is that a lot of interventions and livelihood interventions continue to be supply driven. And by that, I mean they supply skills, they supply jobs, rather than trying to understand what refugees are doing themselves and trying to remove the obstacles that refugees themselves are facing. And I think in this supply driven model, unfortunately, we'll continue to miss on integrating the perspective of refugees and therefore not truly support their aspirations and support the kind of actions and the agencies and what they already put in place.
Thanks, Vero. Really interesting. I mean, in my career, the things that whenever I've worked in refugee settings always comes up as the top priority, especially after the first 5-6 months of displacement, is jobs and education, wherever you are. So there's jobs and education. And education, the future of their children, is almost invariably the thing that refugees focus on and drives a lot of their choices. So I want to come to you, Lorna, because that's what you've been trying to do, really, support the aspiration the refugees have for their children and obviously, the aspirations of refugee young people themselves. Can you tell us a little bit about your experience in really guiding them to some far-fetched places, really, from where they've ended up in many cases?
Sure. And thank you, Sarah, for organizing this. This is wonderful and a great panel. And I'm sorry I'm not there. And actually, just following up from what Veronique just said, something else to add about the work permits is what I've heard from the refugees we've spoken to, especially in Jordan, is that there's an uncertainty if they will lose their aid if they take the work permit. So there's still some ambiguity and some concern from refugees. If I take this work permit, do I lose the aid for myself and my family? And because it's not 100% in black and white, and the governments haven't been 100% clear on this, there's also that uncertainty and that fear that I'll drop out from the aid part if I take this job. Because also we know these jobs are not, as you just said, the jobs that they really want to take. Sometimes it's what they're just being given. I'm an engineer now, I have to go do, farming. I mean, whatever. So sorry, I'm supposed to talk about education, but I just wanted to follow up on that one piece because we're part of that too. But that goes hand in hand with the education piece. So again, there is, if you look at what the majority of the big humanitarian agencies provide, it's shelter, it's safety, it's food, it's basic needs, and education really does take a back seat. Primary and secondary education, for the most part, I would say, is available. The quality of teachers may not be spectacular sometimes, depending on the country, the camp, et cetera. And everyone's doing their best. And trust me, I know that. There's not enough funding for the big humanitarian agencies doing a lot of the work. And therefore, this just falls through the cracks. What we do is we look for brilliant kids and we take them to the best universities outside of what I call the bubble. Why it's important for us, and many others take them to universities in the host countries, and that's fine. And trust me, there are enough refugees where we need everyone to jump on board and help in whatever way they can. But what we do is we focus on these brilliant kids and we take them to top universities. The first kid I took out of a camp was from Dadaab refugee camp, as we all know, largest refugee camp in the world. Well, maybe not much longer because they're closing down the camp, but this was 500,000 people when I started working in Dadaab almost 10 years ago. And found the first kid we took to Princeton. Well, I took to Princeton. I was still working my full-time investment career when I started this on the side, and then it became something full-time. And Abbas went to Princeton and finished with a 3.5 GPA. Then I sent him to an MBA at the European Business School in Germany. He works at JP Morgan. This kid, if it had not been for our intervention, would still be in Dadaab with absolutely no future. He is the number 2 in the risk department at JP Morgan. The boss leaves, he's the boss. I mean, these are the kids we look for. And like him, we have a ton of Abbases. So after the Syrian crisis hit, we started, of course, looking at more Middle East. We had started in the Middle East, in Lebanon and Gaza with Palestinians, who, and of course, we all know they've sort of fallen through the cracks as well, because now the focus primarily is on Syrians. We can't forget our Palestinians. So we have our Palestinian students, and then we have our, of course, Syrians now primarily, and we still, of course, work with Africa. But I'll give you one story of why it's so critical, I feel, to take them out of the bubble. There was this kid, Samir, Palestinian, living in Lebanon. Angry young man, very angry, just from what he sees as injustice and whatever. I mean, he was in this bubble, and all he hears is what's around him. We took him, I sent him to Dubai to university, and his teachers from UNRWA, who were very close to, and we worked very closely with UNHCR, UNRWA, of course, all the top UN organizations working on the ground. They said, this kid is in that critical period that if an opportunity does not come for him, he could go join a bad, dark side. And that's that critical age where we have to intervene. If we want to bring peace into this world, we have to give these young kids an opportunity and alternatives to do things with their lives and do things for themselves. So we sent him to Dubai. He prospered in school. He now works at MasterCard. And even at MasterCard, I mean, so after being at university for just a couple months, he said to me, Miss Lorna, yeah, they call me Miss Lorna. I feel like back at my teacher. I was never a teacher. But Miss Lorna, you know, I thought Palestinians were the most hated people on earth. I thought everyone just had it in for us. Of course, he's in his bubble in Lebanon, in Tyre, where that's all he hears. He said his roommates were from India, China, and Nigeria. He would say, I'm up till 3 a.m. talking to my roommates, and I'm learning so much from them. And my God, do they have it bad in India? And wow, China and Nigeria. And he said, I no longer see myself as a victim. I now understand the plights in other parts of the world. And he, on his own, stopped being a victim and stopped seeing Palestinians and himself as that rhetoric where he was in that bubble. So for me, taking them out, extracting them from that, giving them opportunities, alone, they start forming a new understanding of what refugees and themselves look like in the world. And I think that's critical, but it's giving them opportunities. And that, at the end of the day, that's what we all want, is having our children have the same opportunities everyone else has. We want inclusion, and we want a chance to thrive and self-sustain. And so that's what Blue Rose Compass does primarily. And we have boys and girls. It's extremely hard to get a lot of the more conservative girls out, and we have to have a lot of conversations with families and make sure that, you know, the girls are going to be safe. And we do that. We go that extra mile. One last thing, and then I'll stop. You know, at UPenn, there's a professor, Angela Duckworth, and she's come up with this whole concept of grit. And grit comes from individuals who have been through extraordinary situations, who bring a whole different perspective because of what they've experienced in their lives. And I can tell you something, our students thrive in any of the Fortune 500 companies we put them in. Either the first ones in, the last one's out, the first ones to volunteer. First of all, they're so grateful for the opportunity they have. They show up, they work hard, they're an asset. They're not burdens, these are assets. And any company that has them continues to thank us and continues to hire our graduates. They fight for them, actually. We have to like negotiate with the different companies because they fight for our graduates every year. So I wish more people understood that refugees, absolutely not a burden. They're like everyone else. They're like you and I. Actually, I was a refugee, so absolutely like me. I fled Nicaragua when I was 9. I was a refugee in the US. I had opportunities. That's the only difference between me and people that are stuck in situations that they can't get out of. I'll stop there because I know we have a longer conversation to go.
Thanks, Lorna. Let me come to Ziad. I mean, you know, what Lorna presents is a different way of engaging with what we would call in the aid sector the refugee caseload. But UNHCR has come a long way to try and understand in what ways you can support, you know, their aspirations differently. You know, as head of the livelihoods unit, you've been looking at different, more innovative way to engage with them. What are the key takeaways? What are you really trying to do differently? Where it works, where it doesn't?
Thank you very much for this opportunity to meet the audience. And let me start by going back to the initial question, what do they want? What refugees want and what's their need? From what we see on the ground, from our experience, from our interaction with refugees, refugees always want a solution. So this is where we should start. And the perception that refugees want to take advantage of the asylum system and stick to wherever they arrive needs to be critically discussed, because what we saw and what we still see in different caseloads, in different refugee populations, the first answer for a refugee when you ask them, what do you want now, is a solution. We want primarily to go back home. So the first solution is actually political, to achieve return. However, we all know that this is not available, and it's very tricky to wait until a solution is achieved. And the return solution is one of the rare solutions in the world. Most of the refugees cannot achieve return because of the political situation, cannot achieve full integration in where they are living. So what they need actually in this non-functioning situation, they need dignity and they need protection. The protection has different aspects. It has the legal, the physical aspect. There is an assistance side of the protection also. So refugees need assistance. So when we discuss the question of dignity, we should not sideline the assistance and consider that refugees should be directly become self-reliant, because when they face the shock of displacement, there is a need for assistance at some point. However, the question that the world now is trying to face is, how can we phase out of assistance and achieve dignity and achieve self-reliance for refugees? To answer this question, refugees want self-reliance. They want dignity also. So also this should be our starting point. When you ask a refugee also, what do you want? Okay, if I am stuck in a place, I can't go back home, at least give me an opportunity. And Lorna described this in a very passionate way. People need an opportunity to prove that they can become productive, or become productive after a period of inactivity due to the displacement. Most of the refugees were, maybe all of the refugees, were active in their countries. They were working, they were making money, they were earning their livelihoods. So when they face displacement, there is a situation of inactivity due to the displacement. It could be 1 month, but it could be also years due to the system. So to achieve dignity, to achieve self-reliance, what we want now is a different way of doing the business that we used to do. UNHCR and I think all the international community now acknowledge that there is a need to do the business differently. The old model that we used to apply, which is UNHCR is the fully responsible agency for the refugees in the world, is not functioning anymore. And this is where there is a need to do business differently. UNHCR acknowledged that, and the international community and the General Assembly of the UN acknowledge that. This is where there is now the literature around the Comprehensive Refugee Response Framework and the Global Compact of 2018 for refugees and another Global Compact for migrants. So what's required now in order to make the Comprehensive Refugee Response Framework and the Global Compact, to make them a little bit more concrete, because we know that this is literature so far. There is literature, there is a General Assembly decision, the New York Declaration that happened in 2016, November 2016, also called for a global compact. From now until we have the Global Compact, how are we moving towards refugee self-reliance? I think there is a major need now to create models to show that refugees could be part of development and should not be a humanitarian issue. It is a humanitarian issue by nature. It happened because of a crisis, And the first phase is to tackle it in a humanitarian point of view. However, with the current magnitude of the refugee situation, 65 million persons, at least UNHCR, we work in around 170 places. So it's everywhere. It's affecting the world. It's affecting most of the world population, which means that it cannot remain a humanitarian issue. It should be a global development issue. And this is the start. This is how we can start tackling the problem. Once we agree on that, I think most of what Veronique mentioned in terms of issues that the research showed could be tackled, but in a different way. When we say that the lack of understanding of aid agencies, of the refugees' needs, is an issue, I fully agree on that. And actually, we should ask ourselves why aid agencies are doing livelihoods for refugees. When we say livelihoods, we talk about jobs, employment, economies, local economic development, value chains, and all these things. Why we are leaving these things when it comes to refugees, we're leaving these things to humanitarian organizations to do it instead of development organizations to do it. So this is the big question that UNHCR is trying also to contribute to its answer. What we are doing in UNHCR is that we're doing an institutional change, a cultural change in the organization. Livelihoods, for us, in the global strategy now, livelihoods for refugees should be a development issue. So this is the starting point. Organizations who should be tackling livelihoods for refugees should be the usual organizations doing economic development. So it's not UNHCR to start with. However, UNHCR is contributing to creating, as I said, models that function for refugees. One of them I can mention a lot. I don't want to take all the time in mentioning what UNHCR is doing, but I can answer questions maybe later on. But for example, we've worked with ILO to take the value chain development approach that ILO has in the local economic development arena, to adapt it and to tailor it to respond to local economic development needs where refugees are located. So this work is trying to answer the political question that we usually face. How can we integrate refugees in local economies where there is poverty and there is unemployment and there is an economic problem? The answer that we're trying to put with ILO is that why don't we plan for local economic development, taking into consideration the presence of a specific population and trying to identify which sectors could be targeted in order to achieve added value for the local economy, but also achieve employment for the refugees and for the host community. This is being put as a political question. However, the answer should be technical. It should be technical somehow because it's about sectors, value chains, economies, and so on. So this is one of the areas where we are trying to do something since 2013, and now it's part of our global strategy. The question of poverty, it's common. Poverty has the same features everywhere. And refugees also, refugee populations, should be classified somehow into the poverty scale. Looking at the refugee population from one poverty lens is also one of the weaknesses that we used to have in the humanitarian work. We used to consider that everyone is poor in the refugee population, and this is not correct. We should have a poverty scale as we have in any population. Maybe 4 grades, 5, it depends, maybe 1 poverty line, those who are under poverty line, above poverty line. So the issue of poverty analysis is an issue. This is where UNHCR also is trying to do some work on it. And we are using, in addition to the analysis, we're using also the graduation approach, which is a poverty alleviation approach created by the World Bank. So we are working with those who implemented the graduation approach on non-refugee contexts. We are working with them in order to prove that this can work on refugee populations. We've already done 6 countries pilot. We are expanding this year. And actually the achievement that we want to see, the outcome of what we are doing is not us scaling up the graduation approach to do poverty alleviation in the world for refugees. This is the old model. What we are trying to do is that more refugees should be integrated in poverty alleviation programs in host communities and host countries. And the first breakthrough that we saw in this area is the World Bank feasibility assessment for that in Lebanon, but also a bigger program is what's happening in Uganda. The USAID, which is a development agency, it wasn't part of the humanitarian community. USAID does development usually, and USAID now is considering a $33 million program for poverty alleviation, including refugees in Uganda. So this is the model that we want to see, big-scale programs instead of small initiatives targeting refugees. The big-scale programs need some evidence base. And this is where we are working also on building this evidence base to show that it is possible. And the scale up, the adoption should happen, needs to happen later on. I have a lot of other examples where UNHCR is intervening, but also that we need to tackle the issue of the relation between the assistance and the self-reliance. There is always a question around if refugees want self-reliance and they want dignity, should we link employment and jobs with the cut of assistance? This is leading to some problematic situations, as Veronique mentioned also, where refugees sometimes hesitate to sign up for employment if they know that this will lead to cut in assistance. And I think this is where there is a lack of understanding, not only in the humanitarian community, but also at the government level, of how should we tackle the relation between social welfare and social protection and employment. And I don't think this is a problem in the refugee population only. I think this is a problem everywhere. It's a global problem. And linking this problem to the refugee population is unfair, because poor people in all the world is facing this problem, and governments in all welfare states are facing this question and this problem. So now bringing back this question to the refugee population will show will give a wrong impression that refugees don't want to work and refugees are dependent from the assistance, which is not correct. So this is something that also I wanted to bring to the table to trigger some discussion around it. I will stop here. I have...
we'll come back to this. I think
yes.
You fit on a couple of really, really critical issues for our conversations around, the trade-off between assistance or jobs and self-reliance, and this is one of the critical challenges. So I'd like to hear what the rest of the panel thinks about it, and this also progressive shift in the aid sector towards long-term development in refugee settings. I think those are two things I'd really like the panel to comment on. But before we open the discussion on that, I just want to ask Tamam to really reflect. Ziad has been talking about the changes, in the refugee landscape and how we're becoming progressively awareness of the reality of the refugees and how this has been shifting. The health sector is a particular one where, I think for MSF in the Syria crisis, there's been a bit of an awakening around the kind of aspirations that refugees had in terms of their health needs. Can you tell us a bit about that and the journey that the organization has gone through in responding to, these aspirations?
Thank you. Thank you, Sarah, for having me. To start with a disclaimer, I was telling my sister that I'm in a panel on what refugees want. And she looked at me half jokingly or half more seriously than jokingly and said, 500,000 refugees in this country and they ask you. So fully acknowledging my disability in terms of reflecting what people actually need or want. What I would talk about is the pure humanitarian assistance, the emergency assistance that we provide in MSF and many other agencies do. We have been providing assistance to new situations with all the information. We've been dealing with refugees as we dealt with the factors that governed refugee situations 20 years ago. So in essence, we have assumed that refugees are always displaced into a camp, as the 90s have seen. We have assumed that they have massive physical needs, massive health needs. Most of the large refugee settlements, like in Dadaab that was mentioned, in Congo, in Uganda and others, have been ones of convenience for the humanitarian aid system, because you have a fence, you have a population you can count, you can set up a hospital and be done with it. And if you have enough time to provide the critical medical aid, then you're good. If you don't, you don't. What we have even canned it. If you know of MSF's somewhat known book called Refugee Health from 1997, we have said at the time there are 10 priorities. If you fulfill them, you're good, and they should apply to every situation wherever. Obviously, that isn't the case. I don't think it has any time been the case. Today, in addition to the numbers, the sheer numbers that Ziad have mentioned, most refugees are not in camps. They are in open settings with host communities. They live like other people in circumstances that range from extreme poverty to situations that are less poverty-ridden or causing of the severe physical need they have, whether medical or otherwise. So when an aid agency goes and assumes that we are going to set up a hospital, treat malaria, and we find that we are having actually displaced populations. And this is another point that isn't probably to be discussed here, but this forced displacement is probably a wider umbrella that shouldn't be ignored, because we have evidence that internally displaced people are twice as likely to die than refugees. But that's beside the point. We're seeing people who come from middle-income countries. The Syrian refugees in Lebanon, for example, where we treat them, we have been treating them for several years, are suffering from long-term diseases, from non-communicable diseases that aren't malaria that can be treated in 3 days, and then everybody can go home. What we assumed is that we do it like everything else. So we set up a primary healthcare structure that should treat non-communicable diseases as it treats anything else. That has failed spectacularly, because what we have failed to acknowledge is that Syrians in Lebanon had come from a medical culture that is very different to other populations we have dealt with. And that difference is wide enough that we couldn't ignore those variations anymore. So instead of trying to simplify the treatment, we have hit a condition where people actually want to know what's wrong with them, would like to know why are we prescribing the treatment, why did they have a regime of treatment that seemed complicated with many pills, and we are giving them a simpler one that seems less sophisticated than what they are used to. And the explanation of that required that we actually moved from primary healthcare setting to a non-communicable disease setting, whereby we have created a counseling part, whereby someone sits with the patient and explains exactly the treatment. You'd think that's common sense. You'd expect that from your physician here in the UK. It didn't hit us, because we have been treating refugees in severely low-resource settings. Now, that is interesting that we could deal with that, but that is a cause of reflection, because now I couldn't justify to myself to go back to South Sudan and think, well, I have to explain to the Syrian because they require the explanation, but I don't have to explain to the South Sudanese because they don't. The moral reflection that one gives us implies itself to the other. Then what are the needs? Short term, obviously, people who are displaced need to be safe. As far as we can assess, they need medical treatment, whether their treatment is interrupted or when they are afflicted with a new disease. I assume they need to know what's going to happen to them. Mid to long term, I have no idea. We are an aid agency. But what hit me is I have to paraphrase Paulo Freire, and sorry for Portuguese speakers, I probably am pronouncing it wrong. is he's talking about education. And I think it feels the same here. We should probably start, rather than the dichotomy of aid and development, start by moving from a humanitarian to a humanist approach, move from dealing with refugees as objects to subjects, objects as ones that are known and acted upon, to subjects that actually know and act. And then they probably be able to tell us. Some of it can be achieved in a humanitarian context. We can actually adapt ourselves from setting up a template service, whether that is a medical service, to setting up a flexible one. We have had slogans in the humanitarian system for very long that need to be adapted. Those include beneficiary feedback. Beneficiary feedback has meant for the longest time that you go and sit with the community leaders. Usually, in my most vivid memory, those are in Ethiopia and Somalia, older men with big beards that are, community leaders. And they'll tell you what they want, and you'll try to squeeze as much of it as you can in your program. Well, that doesn't work anymore. That doesn't work because we are saying that there are groups of people who cannot speak out unless we conscientiously allow that opportunity. We have realized by having medical services that sexual violence is prolific in almost every refugee setting. So we can that as well and create sexual gender-based violence services everywhere. Ignoring that this is not the only problem. So a woman who hasn't, I'm sorry to say that, who hasn't been attacked or subject to sexual violence is completely fine. She's as well as any man in the community. Well, they probably aren't. And asking the questions without having every service put in a template is probably a very good step towards moving from a refugee or any person we serve as an object to as a subject that actually makes part of the decision. It's not easy. We are programmed in the humanitarian sector to find solutions, create a template, and just spread it as far as we can, because there's an illusion of urgency. The urgency exists definitely in many cases, but the urgency changes. Dadaab, which was mentioned by Lorna, has been there for quite a long time, so have been many of the refugee settings. And they would have allowed us to adapt our services to people we are trying to provide that service to in a way that suits them. This is a conversation that is still very shy in the humanitarian sector. Our development colleagues probably are much more versed into it, but I think we are unable to continue providing humanitarian aid effectively and in a satisfactory manner without actually addressing those questions quite closely, adapting them, and changing probably our culture as the circumstances change around us.
Thank you very much, Tamam. That's really, really powerful. And, it poses the question of whether the question is around shifting from a humanitarian to a development model, or actually rethinking these models altogether. Because I think what you say about the illusion of urgency in humanitarian settings is very powerful. That doesn't necessarily mean that the solution is long-term development per se, but it's more a combination, if you want, of the various tools that we have, in the toolbox to be able to really, engage with refugees, as you say, as subjects who know and act. And that, Veronique, is very much at the heart of a lot of things that come out of the research. It'd be useful to hear about some of the things that have actually worked better, those who have perhaps been able to, cut across some of these, binary divisions that haven't really enabled assistance to be centered on what people wanted and could really pursue themselves.
Well, it's very interesting, and I think I'd like to go back a little bit to what Ziad was saying, that, refugees at first need assistance. You need to phase out to go to self-reliance, and after a period of inactivity, they can become active again. I just take the example of the work I did in Cameroon, and I spent quite a lot of time doing interviews with okay, just 160 refugees, but we really tried to gather in depth their life history. So trying to understand what happened from the moment of displacement to where they were. So some of those refugees had been displaced for a year and a half, and some of them for 10 years. And I think what was really striking, and again, going back to this idea of phasing the way you respond to refugees and you support them in displacement, was that we didn't see any of these stories. We didn't see assistance first and then phasing to self-reliance. What we saw is refugees having very different livelihood trajectories. So some refugees came and were completely traumatized, unable to do anything, and needed to be taken care of. Many came and said, okay, well, I have this money. I know so-and-so in this village. I'm going to move there. So-and-so used to trade with me, so maybe I can do business with them. And that's people who, on the first month of arrival, are able to be active. So I don't think there's such a thing as looking at a phasing of what refugee, needing assistance and then livelihoods. And it was quite interesting speaking to one humanitarian worker there who said, we assumed that some refugees would be fine for the first year. And actually, that was quite a good understanding, because those refugees who self-settled in the host communities, those Central Africans who self-settled in the host communities in Cameroon, were actually really fine for the first 9 months to a year. And one of the reasons why, they came with assets, so they had some financial assets. They were able to use and get support from pre-existing networks. So these were either family that had moved from a previous refugee movement to Cameroon, or friends that they had made. Also, Central Africa and Cameroon are very close. Some of them had in-laws, Cameroonian in-laws in East Cameroon, as well as, trading partners. And we saw that for many, immediately after their arrival, they were able to use those assets and use those networks to sustain themselves. But also what's interesting in this idea of, refugees are, first inactive because of the trauma and the shock of displacement, and then you can then support them in their self-reliance, is that we also saw many refugees that had been in Cameroon for 10 years, and that were old men and old women, and that said, I've done what I could, still remaining quite poor, but now my kids have left me behind, and I no longer have any help. And so also understanding that, it's not so much about, and it's interesting we brought out this assistance and job dichotomy. It's really about understanding how, livelihood as it is here means that there will be, high and lows, and some refugees will be able to sustain themselves and access and find livelihood opportunities early on, others may not. But what is needed is more adaptive programming that really fit with how refugees go through their displacement, understanding that some will need the help early, others will need the help later, and that it's not, this assumption that they're vulnerable at first and not later is not true. And we see that in the Syrian refugee crisis, where actually 5 years on, you see a high level of indebtedness, and where refugees have not just, needed to use the assistance, but more.
That fits well with what Ziad was saying in terms of not really looking at refugees with one single poverty lens. But I guess to do what Veronique is suggesting, particularly in the earlier phases of the crisis, you need to have the government on board. If you really want to make sure that refugees can use their assets productively, you need to enable them to work, and that's often the challenge. So I'm surprised that we haven't heard much about the role of host governments in this so far, because they are critical in enabling refugees to fulfill those aspirations.
In fact, I noted here that I wanted to say it's we haven't tackled yet the most important point when it comes to livelihoods and dignity and self-reliance, which is the enabling environment and the legal framework. The whole problem now is about rights and access. It's not about the technicalities of how to do the things. What I mentioned before is more focusing on who should be doing what and what should be the direction. But even before that, the enabling environment and the legal framework is the most important. It is the starting point, because only around 47%, as I remember from the statistics, 47% of the host countries give refugees the right to work. So this means that more than half of the countries don't consider refugees as a productive agent, as part of the economy. So how are we going to achieve self-reliance and livelihoods in a place where there is no right, which means there is no access? And even within the 47%, where the right is granted, there is no access because of other reasons. I can give many, many examples in places where the refugee has the right to open a bank account. The banking system doesn't allow the refugees to open the bank account. So by law, they have the right. When they go to the bank, the bankers tell them that this is the first time we see this case, we can't open a bank account. And this takes sometimes years to change. Working with the central banks, working with the governments, with the authorities in order to have a change in practice. So it is really a foundational discussion here that we can't achieve anything if there is no legal framework. But to go back to the issue of how to do the business, from our experience, it's the best way is to benefit from the available services, from the available systems, and not to create parallel systems. Sometimes we need to convince that this is the way to go, because you see on and on creation of parallel systems, sometimes with good intentions, but creation of parallel systems lead to many issues, and one of them are related to quality issues. And I take what Tamam mentioned, the beneficiaries' feedback. If beneficiaries' feedback is something that the private sector does, then maybe we can do it. But if you go as a citizen to a clinic and they don't use with you beneficiaries' feedback terminology, why should we use it in a refugee context? So I fully agree with Tamam that when you use an available system, when you use what's functioning at least, because in some host countries, systems are not functioning, which also add complications. And also Tamam maybe mentioned something about South Sudan, where sometimes the refugee population start receiving higher standard services because it's coming from an international community, and in the host community there is lower standards, and this is where also the complications become even more difficult. So using the functional available services lead to some mainstreaming and lead to mitigation in issues of quality and issues of responsiveness and many other issues.
So the reality, we often get stuck in these conversations around the quality, around the curriculum. Actually, I want to come to Lorna because I've been part of a lot of conversations around, the Syrian refugee hosting countries where we have made the necessary advance and, sort of the education provision for refugees because there's been, this paralysis around the issue of the curriculum, and it'd be useful to get some reflection from you, Lorna, since that's pretty much what you've been engaging with.
Sure, and because I also have a tech company that works with refugees, I tie into both the livelihoods piece and the education piece. So actually, Zia, very funny you mentioned the bank accounts. I have to send faculty with our students to open up their bank accounts, because if they go alone, they can't open an account. So I have to send a teacher with the student to vouch for the students so we can open up bank accounts and we can wire them money monthly, or else they can't pay their rent, right? So I'm with you on that. I want to mention something else, though. So in our Global Future Council at the World Economic Forum that Sarah and I are both in, we have a mix of private sector and humanitarian organizations and NGOs all in one. And I think that's where Ziad touched upon this earlier. There is a different need and a different way of looking at things. Also, Veronique touched upon it as well, that we have to think about this crisis differently, and we can't just do it's not business as usual. We have to bring other players into the mix. And what I have found through my work is that corporations are incredibly willing to be a part of this. They just don't know how. When you're Orange, it's not your thing. You're based on your telco, but you want to be a part of this, but you don't know how. So being able to first engage with those that are on the ground and understand what the needs are is incredible, because now they get to be a part of the solution. We need them, they need us. It's a win-win. And we're finding that many companies, another one's MasterCard, which is also another council member in our group, and incredibly active with financial inclusion and digital inclusion for refugees. And I'm partnering with them in many big ways. And I think that's key to mention the private sector involvement when it comes to refugee and refugee population. I know you want me to talk about the curriculum, but there's one more thing I wanted to, regarding livelihood. So the tech company that we're launching, and again, work permits, which Ziad just mentioned, and I had marked as an exclamation marks a while ago, so I was waiting for my turn. Absolutely. Without having government buy-in and allowing the space and the environment for refugees to work in legally, it makes it virtually impossible for you to give them any real opportunities. Because if the permits aren't there, how can you work legally? How can you go set up an entity in a country legally because you want to work with refugees, but you don't have access to work permits? So it kind of just stops you right there, dead on your tracks. And we tried to set up Link, my tech company in Kenya, but we couldn't get the buy-in from the government because, of course, it's helping Somalis. And they're like, why don't you help the Kenyans first? And I'm like, well, that's not how we work. We're working with refugees. And so we then looked at Jordan, who said we are giving work permits to refugees. And immediately we were able to get in there. And now we're launching this in Jordan. And just to briefly talk about Link, we're hiring 50% disadvantaged Jordanians. So these are Jordanians that also cannot find work. And we all know that, of course, when you have an influx of refugees in these countries, the hosting population absolutely does, I'm going to say, suffer. I don't want to call the refugees coming in a burden to anyone, because I don't see them that way. Again, I was a refugee. I don't see my father, who was a medical doctor who could not practice medicine in the US, as a burden. He would have been an asset if they had used him properly, but they didn't. And so we hire 50% refugees, 50% Jordanians. And to me, that's peace building. Now we have refugees and Jordanians in a room working together on learning how to build software app development programs. And they graduate from this 4-month training academy, and we get them full-time jobs. And again, for me, that job at the end is crucial, because that's what's going to allow you to have that dignity and allow you to just rely on yourself. And really, that's what you want. You want inclusion and just belonging. That's what we all want, is just to belong. So Link is critical, and we're delighted that we're finally launching in Jordan. We have all our ducks in a row. Ziad, and I'll catch up on that in a big way next week. And going back to the curriculum, sorry, Sarah, no, sorry, you know, I wear two hats. But going back to the curriculum, yes, of course. Imagine you're a Syrian refugee, you've left Syria, now you're in Jordan. Now you're studying their Jordanian curriculum. You're in Turkey, now you're studying their Turkish curriculum. Then they send you to Lebanon, now you're with the Lebanese. I mean, seriously, how many different curriculums do I have to learn to continue my education? So curriculum alone is a huge problem. I've always said, can't we just have the Syrian curriculum in all the places where refugees are? But I know that many of us have believed this, but I know it's incredibly complex to do this, because of course the hosting government wants you to learn their curriculum. You're in their government, you're in their country. I get it, but it would be wonderful if we could allow them to just continue their own curriculum that they know, which is somewhat different than the Jordanian and the Lebanese and the Turkish and the whatever else. So the last point of curriculum, I have to point out, the government of Argentina has given my nonprofit Blue Rose Compass 1,000 scholarships for Syrian refugees to study and live in Argentina. So it's not only 1,000 scholarships, they're also being given humanitarian visas, which are very similar to the Canadian model, which is extraordinary. Which means that the moment they land into Argentina, they benefit from everything an Argentine benefits from. So free healthcare. They can work day one if they speak English, probably. I mean, they don't speak Spanish yet, but even if they speak English, they can probably get a job. And of course, our 1,000 students will go to Argentina. They're going to be attending the best universities in Argentina. They can study anything they want. We're already linking them with part-time jobs from not the first year, because the first year is just immersion in Spanish, as you can. So now they have to go learn Spanish for the first 15 months of being in Argentina. But they'll be blended in the system, and that's what we are. Of course, again, we all know that inclusion is key. If you're allowed to integrate and be included in the system, and go ahead.
I want to stop you because I want to let questions in and just come to Taman for one last comment before I open up, because there is a lot of people that want to come into the discussions. I want to open to the audience. You can carry on with the audience in a second.
I just have to dispute a little bit the point on the not creating parallel system. And I know that we are in the humanitarian sector, notorious for creating parallel systems. But we cannot take that on face value. The problem is, it would have been lovely if the existing systems were accessible, equitable, and available for refugees. Even when they are in theory, it was mentioned here that in theory things could be available, and in practice they could not be. I'll give you an example. We have a clinic in Athens. I'm not talking about South Sudan. We have a clinic that has opened for refugees, a completely parallel system in the middle of the EU. The reason is not we wanted to build a clinic in Athens. There is a sense of safety that is absent in accessing the system in Greece. There is people who don't want to expose themselves and give their names to the government. There is a stratification that was created de facto because they brought Arabic interpreters, which meant that the Afghani refugees and the Kurdish refugees in some cases didn't have access or interpretation. There are multiple layers of unobvious hindrance to access to the system, let alone the other point. I struggle with the idea of, yes, we will not create a parallel system, yet the current existing system, when available, is so bad that I wouldn't be comfortable with our patients being treated in it.
But you open that to the host community?
Of course, in almost every situation that isn't a camp, it's open to the host community. That's given from an egalitarian point of view, but also from not being stupid enough to upset people with each other point of view.
You wouldn't be the first one.
But I mean, it's not as easy. There is a something to be sacrificed on both sides. The other one is progression in time doesn't guarantee access, and it doesn't guarantee availability. Actually, in many cases, if you look at Eastern Congo, if you look at South Sudan, and on multiple occasions, the Palestinian refugee camps in Lebanon, the fact that a refugee existed in a place for a decade or two or three doesn't mean that they have de facto more access to any service, and doesn't mean that we can cut off something. The one point you mentioned, and I know you don't support that, and that's not the intention, but like many neoliberal policies, things backfire. You cut people from aid so they can work, and we know how that ends up in places that has safety nets. Refugees often do not have a safety net if they fall off the grid, even in rich countries. And I think it's important to remember that just having arrived to Germany or having arrived to the UK, there's a coping to be made. There is an integration, there is a learning of the system, and there is a discrimination and that is prevalent in almost any refugee host community. So it's not as simple as now the services are there, we'll switch you off, go on.